Hello, we're a group of fourth-year medical students from University of Sharjah, and we're here to present to you our research paper under the title Herpes Zoster Vaccination, Knowledge, Attitude and Practice in the UAE.
Herpes zoster is a reactivation of Bacillus zoster virus. This is the same virus that causes chickenpox in children. It affects those who aged 50 years and above, and it causes a painful rash. We chose this topic because we found out that there's a scarcity of research in MENA region, and no similar research was done here in UAE. Herpes zoster affects those who are already vulnerable, and its complication can add to their comorbidities. Fortunately, however, there is a vaccine that can prevent the occurrence by 70%. So, if there is such a strong preventive measure, is our population aware about it? Have they taken the vaccine? Are they even aware about the disease? And what's their attitude toward optional vaccination? These are the questions that was raised in our mind, and we hope to find an answer for them in our research. We opted for cross-sectional, observational, quantitative study design. We targeted those who speak Arabic and English, who aged 50 years and above. Those with medical background were excluded to avoid any skewed data. Then we interviewed our participants. We decided to interview them because we find it more convenient, since our participants are busy adults and it would be troublesome to sit and fill a questionnaire. Although interviewing 420 participants seemed a little bit of a challenge, we obtained a high-quality data because we were able to explain to them any hard term or even have further insights into our participants' mind regarding herpes zoster.
Our interview consisted of 36 close-ended questions which we came up with by reviewing other similar research articles done all over the globe. We have, of course, then modified as well as added some questions to make the interview suitable for our region. We conducted a pilot study and met as a group to discuss some issues with the questions. We practiced the interview together and made sure all of us explained the questions in the same manner to guarantee standardization. We then decided to carry out interviews from 5 to 9 p.m. every Monday and Wednesday from January to March. We randomly picked public venues all over the UAE. We set our type 1 error to be less than 0.05 and use SPSS version 25 to enter and analyze our data. We approached 486 adults and could interview 420 of them. We had an equal number of males and females, and most of our sample completed an undergraduate degree. As you can see here, out of the 420 participants we had, only 64% claimed they heard about herpes zoster, and less than 20% of them actually knew the link between herpes zoster and chickenpox. Those with higher educational levels seemed to have more knowledge about herpes zoster disease, which was also illustrated in other studies done abroad. Regarding the vaccine, in a study done by CDC on a global aspect, 44% of the sample heard of the vaccine, while here in the UAE, only 14.8% heard of the vaccine. The highest source of knowledge was not even a reliable source, it was through friends and family. Those with chronic illnesses were twice more likely to hear about the vaccine, which could be due to their exposure to healthcare facilities and healthcare workers. 63% did not even know that herpes zoster vaccine can reduce the incidence of the disease by up to 90%, while 90% did not know that you can still get vaccinated after the infection, and this had a negative impact on the vaccination rate. To our great surprise, 97% of our participants have not received the HZ vaccination. Low vaccination rates were also seen in a similar study done in the US, where only 7.7% of their participants claiming they have received the vaccine. However, on a bright note, more than 80% of our participants would like to know more about the disease, ways to prevent it, and would get the HZ vaccination if recommended by a doctor. In a similar study done in South Korea, cost was a major barrier to vaccination. However, as you can see here, in the UAE, most participants would rather get medicines when sick or were scared about the side effects of medications. This could be tackled with the use of health awareness campaigns, which emphasize that the HZ vaccination is very safe to use. Our limitations included recall bias, since participants were asked to record whether or not they have had chickenpox as children. Another limitation was selection bias, since convenience sampling was used to recruit participants into the study. To sum it up, our participants had excellent attitudes. They want to know more about the vaccines, would like to know how to prevent it, and would get the HC vaccine if recommended by a doctor. Furthermore, cost was not an issue here in the UAE. Therefore, if participants knew more about the vaccines, they would be more likely to take it. This is where health professionals and health campaigns should come into the picture to fill the gap between knowledge and practice of the HC vaccine.